Hello and welcome to the HeartFit Clinic. My name is Diamond Fernandez and I'm your founder and director of the HeartFit Clinic. Today I want to talk to you about how we differ than going to your family doctor or your cardiologist. And that's a common question we get. And we like to say that we work in partnership with them. But when you look at your family doctor and they want to, your GP there, they're an important hub of your healthcare system. They should be taking care of obviously all the different types of testing that you might be having or medications that you might be taking. So it's important to look at that part of it. But when we talk about heart disease, there's only a few things that they can do. They can do some blood tests with you to look at cholesterol or diabetes risk, and they can kind of look at your blood pressure, which is a very important aspect of heart disease. But other than that, there's not much they can do to see what your risk is of a heart attack or stroke. So that's where we come in. So a lot of doctors, family doctors, will refer us to come to the HeartFit Clinic. And when you come to us, what we focus on is kind of looking at artery screening. So we look at artery screening. We look at artery function. So we look at function of the arteries, because your arteries should be like a garden hose, to kind of see what's happening with that. And when we look at artery screening, we're looking at the health of the arterial wall to kind of see what the function, what it looks like inside by ultrasound. We look at artery function tests, which is called endothelial function assessments. But basically what it tells us is that the reactivity of your arteries, what does that look like? And then we have the ability to also look at some advanced blood tests that are not available at your doctor's office. And with that, we have, when we look at advanced blood tests, we're able to look at cholesterol size, particle size. We're able to look at some key inflammation markers to heart disease. And sometimes it's trouble. Sometimes doctors are big gatekeepers of blood tests, because there's this new thing out now where we want to choose wisely and make sure that we don't burden our healthcare system. But sometimes it could be at the expense of just wanting you to find out where your risk is. Maybe you have a family history of heart disease. Maybe you had a friend who's passed away from a heart event, whatever it might be. Or you've had a friend just, I want to know what my risk is. And so, that's what we focus on. That's why people get referred to our clinic, and that's why we see people that are different than going to your doctor. But a big question we get is, what about cardiologists? And I know a lot of cardiologists. It's just something I've been involved in the last 20 years in doing this. But the point is that a lot of cardiologists are really great, but if you're not high risk, then you might just get dismissed. And what I mean by that is, if you're not coming from an emergency room, if you're coming from an emergency room here and you're going to see a cardiologist, obviously they're going to recommend some different types of testing with you. But if you're just coming to see a cardiologist, they don't have much in their toolbox to see what your risk is of a heart attack or stroke. And so what I mean by that, and I talk about that with navigating heart disease, they can do some really good tests to see what's happening. They can do an echocardiogram. And an echocardiogram is an ultrasound of the heart muscle itself, and it looks at structure and function of the heart. So it doesn't look for coronary artery disease, but it's a good test to kind of see what gets done with that. And then they also have the ability to look at stress testing. And stress testing's been done forever. And it's still a great test to get done to kind of see, one, if you're having pains while you're exercising, or two, if you're having any ECG changes while you're exercising. So those are still important tests to get done. But after that, they're kind of limited, because now you're getting into more radiation exams, and from a preventative side of things, they might not take it anything further than that. So that's where we focus on going a little bit more detail to see where your risk is. Now, a stress test will only show advanced stages of a disease, but heart disease sometimes takes a little bit of time to come into play. And so what we look at is before it becomes high risk, so a cardiologist will look at it. And even if it is high risk, how we differ than going to your cardiologist or, with that part of it, of course, getting to the higher end of things, they can do angiograms. And angiograms are the gold standard for looking inside your arteries. They're what we call, if I take sensitivity of a test, a stress test is about 60% sensitive, meaning that 60% of the time we get it right and 40% of the time we don't, which is not the best of odds. An angiogram is about 90 and change percent. And people always wonder, well, why is that not like 100%? Isn't it supposed to be the gold standard? Well, it doesn't account for maybe microvascular disease, which is smaller vessel disease. It can account for also vasospasm, or the arteries might spasm and have disease that way. So that's why it's not 100%, but that's obviously the gold standard. But coming from that angiogram, you can end up with a stent or bypass surgery or medication therapy. They might consider that as a treatment option for you. But our focus, with our clinic, we focus on external counterpulsation, which is ECP therapy, and we also focus on lifestyle changes. And with lifestyle changes, we talk about exercise, we talk about nutrition, important supplements to take, obviously keeping stress under control. So those are some important things that how we differ than going to your family doctor or even seeing your cardiologist. We like to complement that part of it, and that's what we focus on with the HeartFit Clinic. So if you have any questions, comments, or any observations at all, obviously we welcome them, and obviously we wish you live happier, healthier, and longer. Take care.